Hi, Suzanne here, founder of Caregiver Haven and also the community network that brings together caregivers, seniors, and professionals committed to sharing the wisdom, resources, and support. So today I'm going to walk you through something I see often, and I've seen it in my practice over and over again. And this is medications that can slow the brain function in older adults. And these medications are going to affect memory, balance, and overall quality of life. And many people don't even know that they are taking them. So I want you to be aware. And by the end of this session, you should have a clear understanding of what to ask your senior's doctor in order to protect your senior's brain health. Let's go ahead and get started. All right, what we'll learn today, what the brain slowing medications are, why they matter, the types of medications to watch out for, and what to do if you or your loved one is taking them, and then safer alternatives and non-drug options. And this includes how to talk to their doctors about making changes and making sure your doctors are receptive to this. There's a certain way to do this. Okay, why brain health matters. Well, we don't say the word, we don't walk around and say to people, how's your brain health? That really isn't the words we use. We question people's cognitive function or whether they're thinking straight when they're making mistakes or when they're forgetting things, when they don't remember the person's name, where they don't remember where their keys are, if they don't remember a vacation they had, things like that. That's why we start looking at the brain, and that's part of brain health. So thinking and memory are essential. It's essential because we got to keep our seniors independent as we age. This is extremely important because we don't want to be taking care of them. They don't want us taking care of them. Seniors want to stay independent. And when medications interfere with the brain function, they're going to impact everything from managing finances to remembering appointments or even staying safe in their home. And even one small change in thinking is going to lead to falls, hospitalizations, and needing more care. Unfortunately, medications that slow down the brain activity are often prescribed for common concerns like anxiety, insomnia, not being able to sleep, or even behavioral symptoms of dementia. And these issues are real, but so are the consequences of treating them with risky drugs. In the older population, we always ask, is this medication helping or hurting? What are the side effects? And some memory loss blamed on aging is actually caused by medication. So it matters because reframing common assumptions is going to allow you, the caregiver, and you, the senior, to dig deeper into the quality of life. All right, let's meet the beer's criteria. Now, this has nothing to do with the beer over the counter you buy. The beer's criteria is a list of medications that older adults should avoid or use with caution. And I have that available to you. So take a look at it. In fact, take the list of all the drugs you or your senior are taking and take it over to the pharmacy. And I'm talking about over the counter drugs too. Take that and then take the beer's criteria and sit down with the pharmacist. You'll need to set up an appointment and have a licensed pharmacist, not a pharmacy technician, but a licensed pharmacist spend an hour with you going over the drugs and the beer's list. It's created by experts and it's been around for over 20 years. It's updated regularly and it's used by professionals. This does not mean that when a doctor prescribes a certain drug, they automatically look at the beer's list. Not at all. So it is up to you to look at the beer's list and make sure these drugs are safe. In fact, one of the biggest things I encourage people to do is keep a copy of the beers list with you at all times and ask the doctor, is this drug on the beers list? Unfortunately, many patients and even healthcare providers don't even know this list exists. And it includes medications that are known to affect the brain function and increase the fall risk and cause unnecessary complications. I have seen this over and over and over again. So if you've never heard of the beers list, don't worry about it. Many people haven't, but you're going to be able to ask better questions now. You're going to be able to go to the pharmacy. And the reason I suggest that you take the list with you to the doctor's appointment is if the doctor prescribes a product on this list and you get to the pharmacy and you ask them about it, then you have to make multiple phone calls back to the doctor to say yay or nay whether you want the product or not, the drug or not. So just start at the beginning. When the doctor prescribes something, pull out the beers list and say, can you check and make sure it's not on this list? Many pharmacies will check it for you, but by then it's too late. You got to call back to the pharmacy. You got to call back to the doctor's office. This is actually going to build trust. And I have helped people with their beers list, showing them what drugs they're on. It's not a hard thing to do. They just circle or highlight the drugs that they are on, and they show the doctor and say, basically, I want to get off these. Word of caution, which I'll stop you right now. And this is just a medical disclaimer here. I am not your physician. I am not your physician assistant. You can never stop any medications without your doctor ordering you to do so. Okay. So you or your senior's doctor have got to have a meeting with you and discuss what medications you should change and when. It is not okay for you to do it. This whole webinar is all educational purposes only. It is not meant to direct you in any way to ever stop or start medications. Absolutely not. You must go with the advice of the doctor you trust, and that is the physician you see on a regular basis. Okay, medication type number 1 are called benzos, benzodiazepines, and they're sedatives like Ativan, Valium, and Xanax. Okay, and they're often prescribed for anxiety, sleep issues, or even agitation in dementia. And they work well short term. The problem is in older adults, they slow brain activity. And this is going to make, number 1, memory worse. Number 2, it's going to increase fall risk. They can also be habit forming. This may not be a problem if your loved one is 80, 90, 100 years old and you're not worried about what's a habit, what big deal is it if they're going to become addicted to this type of drug, research is showing that later in life like that, if they're on this and it makes their quality of life better, so what? But if they're 20 or 30 years old and they get addicted, that becomes a problem. Also, too, research is also suggesting the possible link between long-term use and developing dementia. So do we really want to start on this kind of drug when we're only 55 or 65 or even 75, when we expect a long life of independence? And although they're often used in dementia care, this is notable, they're not FDA approved for that purpose. In fact, they often make thinking problems worse. People cannot figure out problems. So caregivers need to ask, is this medication really helping or not? All right. I will tell you that benzodiazepines also work on the same brain receptors as alcohol does. And that should give you pause to think about these. All right. So you can't just quit these drugs. You have to back off them very slowly at the direction of the doctor. That's the only person who can get you off these drugs safely. All right. And I just talked about this. So if your loved one is taking it, it's important not to stop it. It's got to be tapered off, especially with the doctor and medical supervision. Older adults can successfully reduce or stop them, but they have to do it extremely slow. And it depends on the other medications they're on. It depends on the health of the senior, and it depends on their compliance with doing this. So and that's just 3. There's multiple factors you have to look at when you go off these drugs. We just don't pull people off them. Absolutely not. There are specific protocols that are used. All right, next, other alternatives. All right, there are safer ways to manage anxiety or insomnia that don't involve brain slowing medications. For example, there's SSRIs, there's Lexapro or Zoloft are often effective. Yes, they take longer, they're not quick acting like benzos. They take about 2 or 3 weeks to ramp up in the person's body, but that's okay. Then there's not non-drugs options, right? Like cognitive behavioral therapy. It's called CBT, and it can be as powerful. So people can look at that. For sleep problems, it's important to check the root causes of sleep problems. Poor sleep habits come from something, and we have to look at what the diagnosis is. What is the root cause? And we have to try different things until we finally get on a schedule that's going to work. These pills, they're going to offer quick relief, but the long-term strategy here is to protect the brain. And we know that actually CBT, cognitive behavioral therapy, for insomnia is more effective long-term than even sleeping pills, right? Because all of a sudden sleeping pills aren't working anymore, but cognitive behavioral therapy will. Does it take more work? Sure, it does. So start with the root cause, not the prescription, and start asking, what is the problem here? What is the anxiety being caused by? What is the sleep issue connected to? Is it poor routines? Is it pain? Medications might be appropriate, but too often they become the default, and they shouldn't. The default should be the root cause. What is the problem? Is it other medications that are causing it? For older adults, quick fixes are going to mean long-term consequences, good and bad. So you have to take a look at these. What can you take? What is causing this? So before you start in with a medication to solve the problem, ask yourself, is this a quick fix or is this a long-term solution to keep my senior independent? Medication type 2, the non-benzos, sedatives called the Z drugs. All right, what do these include? Ambien, Zolpidem, or Zolpidem, some people say, Sonata, and Lunesta. And while they aren't marketed as safer sleep aids, research shows, they are marketed as safer alternatives. They're also impair balance, impair memory, and next day thinking in older adults. They make the brain work similar to the benzos, just a slightly different chemistry. And like benzos, they're not approved for dementia related behaviors, but they're used there all the time. While people it will help them fall asleep faster, they're not going to improve their sleep quality, and the risks outweigh the benefits for most seniors. And these drugs are still commonly prescribed, but we're learning what they're actually doing. The big thing is the next day drowsiness from Z drugs is a common cause of falls in older adults. And without being told these risks, you're not aware that your senior may fall. And you wonder why they fell. They fell because they were on these drugs. So take a serious look at them. Taping off them, you cannot stop abruptly. These medications also require tapering, and you have to work with the physician to gradually reduce the dose. And at the same time, focus on the root cause of sleep disruption. Why aren't they getting to sleep? How many older adults struggle with sleep because of pain, worry, getting up in the middle of the night, going to the bathroom, or inconsistent routines? Not because of medication deficiency, okay? So start looking at sleep hygiene tips, avoiding screens before bed, keeping a cool, dark room, and going to bed at the same time nightly really do help. Don't look at the news before you go to bed. Good sleep is possible. People do sleep without risky pills. And sleep quality is going to improve more routine with more just routine acts that we set up. It's going to take longer, absolutely. But once you start doing this and you get mom or dad or yourself to bed and you stay asleep, you'll be shocked at how much better you feel the next day. Medication type 3 is called Anticholinergics, big long name. They block a brain chemical called acetylcholine. Now, this is essential for memory and focus. So why are we giving these drugs to seniors? These medications are everywhere. They're over-the-counter sleep aids like Benadryl or Benadryl PM or Tylenol PM. They got that PM in them. Versions of pain meds, bladder control meds, nausea medications, muscle relaxants, and even some older antidepressants. And the problem is they are linked to cognitive decline, confusion, and increased fall risk. So I have to ask you, any anticholinergics in your loved one's medication regimen? Some memory problems are blamed on aging that may actually stem from these medications. And the irony, we give these medications to boost acetylcholine in dementia. And at the same time, people are unknowingly taking medications that block it. I'll say that again. We give these medications to boost acetylcholine in dementia. And at the same time, people are unknowingly taking these medications to block it. Some things you want to know is dry mouth, dry eyes, and constipation are also a signal of an anticholinergic effect. Why does it matter? Because these medications are hiding in plain sight, and awareness is going to make you look for safer swaps. So before you reach for that over-the-counter medication and say, hey, this is really good for me, especially something like Benadryl, you got to remember that at one time, this was a prescription medication only. There was a reason for that. So please stop and think, why are we taking these medications? It's another reason why I often direct and would direct my patients. Any over-the-counter medications you take on a regular basis, doesn't matter if it was once a month, I need to know what those were because they were going to lead to the side effects that anticholinergics have. So I would ask them, please, and take these to your pharmacy and let your pharmacist go over these drugs with the Beers list and with your other medications to see the interactions. All right, how to spot them? Well, they come in liquid form. Do they come in creams? Maybe. Who knows anymore, right? Ask yourself, is there a safer alternative? And for sleep, avoid diphenhydramine. For bladder issues, newer non-anticholinergic meds are out, or even pelvic therapy might help. I have seen pelvic floor exercises change people's lives. Where do you find a person that specializes in pelvic floor exercises? I usually have found them at the gynecologist's office. They're called physical therapists who specialize in this. They hook you up to a bunch of electrodes and they give you feedback when you squeeze muscles. And when you see that the needle on the machine doesn't even move, you know that you're not squeezing the right muscles or doing anything. And they train you to figure out the right muscles in order to help with pelvic therapy. It's amazing. For itching, there's non-sedating antihistamines like loratadine that you can take. And the goal is to relieve symptoms without compromising the brain function, and the heart too, for that matter. And you can often recognize these meds by their side effects, the dry mouth, the constipation, or the drowsiness. And reducing anticholinergics is actually going to improve alertness, energy, and independence. We're back to that independence again. Okay, medication type 4. Antipsychotics and mood stabilizers. These are powerful drugs, and they're meant for serious psychiatric conditions like schizophrenia or bipolar disorder. I see them advertised on TV all the time. They are pushing these drugs. But in older adults, they're often prescribed off-label to manage behaviors like agitation or paranoia in dementia. And it's very concerning because antipsychotics slow brain function, worsen balance, and increase the risk of death in people with dementia. And you hear them on TV. They say may cause death. Some of them may cause cancer. Some of them may cause fall risk. I mean, it's amazing. And they're saying that while the person is out playing baseball in a park. Has nothing to do with the side effects. If they showed pictures of people falling, seniors falling, and saying the side effects, people would get very nervous. All right. And they can be useful in extreme cases, but it's a last resort. There is what's called a black box warning, the black box warning. And when we see this, we just, most most providers don't use it when they see a black box warning, because that's the ultimate no. And what it means is that these drugs carry serious risks in the elderly. And common ones are Risperdal, Seroquel, Zyprexa, and Haldol. You've seen these advertised on TV. Don't risk your life with these, or your senior's life with them. All right, safer ways to manage dementia behaviors. Often often behaviors come from unmet needs, pain, fear, boredom, or confusion. And before reaching for the medication, we have to explore the environment and the relation that these people have with other people. These are the strategies we look for. Could more routine help be the key? And this is something that all nursing homes, assisted living homes, community homes, adult daycare centers, they all have a routine. Why? Because the elderly, especially with dementia, they get into these routines. They know they're safe with routines. So, yes, more routines could help. We don't want to overstimulate the person. We don't want to make them lonely. We want to keep them engaged. So, music therapy, physical touch can work. Validation techniques work much better than sedatives. If a drug is needed, it's got to be low dose, it's got to be short term, it's got to be closely monitored. I'll say it again: short term, low dose, closely monitored. So ask yourself always, what can I try first? All right. We're putting a routine into the lives of our seniors with dementia so they don't have to reach for these black box warning drugs. What if they're already taking these medications? Well, I'll tell you right now, the only way to look and see if they're taking these drugs is to take them to the pharmacy if you're not sure. Get the Bayer's list, which I've provided for you. Look at them, then take them to the doctor and say, these are the drugs I'm concerned about. I really don't want them on these. What do you suggest? See if they suggest other non medication forms. Now, I will tell you, most doctors can't give you other things. They have a 15-minute appointment with you, unfortunately. And when they see your senior, they're in and out of the office. It's 5 minutes to dictate, and usually 10 minutes to see the patient. And so the only thing they know is to give a drug. I have had patients say to me, but I don't want any drugs. And I am at a loss, because even in the practice of medicine, you don't know other things. But I will tell you that there are so many other things that you can reach out for. Ask about physical therapy. Ask about counseling. Ask about the guide program. Ask about respite care. Ask about senior care professionals that absolutely know the behaviors you need to start working on to get your um, senior off these medications with the guide of their doctor, of course, and into behavioral therapy, different changes in their behavior and routines. Don't forget about routines. So you can never quit these drugs cold turkey. What if the doctor wants to start you on one of them? Here, just take this one. Well, that's unfortunately more the case than not. So bring that Beers list with you and ask, are there any non-drug options? As I have said, there are so many. Another thing you might look at is palliative care. Many people don't understand palliative care, but palliative care is a wealth of information, and it's the whole person experience. It is not just, it's not, has nothing to do with hospice. I'll tell you that right now. Palliative care, people go in and out of palliative care all the time. Hospice, most people go in and they never get out of it. But with palliative care, no, they go in and out. And these are the nurses that are dedicated to help the person regaining health. They are amazing. Ask about palliative care. Once you start meeting these group of professionals, they may be a psychiatrist, a nurse, a physician, a social worker. They could be a geriatrician. They could be even a geneticist in there, a pharmacist in there. They're a group of people that surround themselves to the elderly and protect them. It's amazing what they do. Um, and if they want to put you on one, just be polite and say, you know what, I'm just looking right now to get off these drugs. And you may have to find your own alternatives. And that's what our community is for, to give you the answers you may need for alternatives. All right. Start building a safer and simpler medication list. Less is often more when it comes to medications in older age. Each additional medication increases the risk of side effects, interactions, hospitalizations. I will tell you from personal experience, seniors that have walked in my office and look like they're 90 and they really look 70 or 60, I look at them and then I look at their medication list and they're not on any medications. And then I've had seniors with 20, 30 medications. They're supposed to be 60 and they look 90. Just from clinical experience, I will tell you there is a significant difference. So, a good, clean, short medication list. Some medications I'm not anti medication. Medications are good for a lot of people and they are necessary, and I totally support any and all of the doctors that give these medications. What I'm saying is a regular medication review is imperative every 3 months, or when a new medication is added. There is a rule of 10 that most good doctors go by, and that is if they are on 10 or more medications, they do not get another until we drop one of those medications. And I'm not talking about just prescription medications. I'm talking about all the over medications they take as well: creams, powders, and liquids and pills, all over the counter. Okay. So if they're on a total of 10 or more over the counter and prescribed medications, one has to be dropped. That's called the rule of 10. Talk to the doctor about it and say, I want to practice the rule of 10 and the beers list. All right. So today we've covered what the brain, the four of them are, the four types of medications. Slowly but surely, they have to come off them, and you have to look at alternatives, which are going to take longer, but you're going to have a huge peace of mind when you do this. I promise you. I've seen patients perk up. They come off these medications, they just perk up. They become, and any hospital nurse or doctor will tell you when we take them off these medications in the hospital, where they perk right up. It's amazing. And another point here is be aware, because many times your senior might end up in the hospital and be dosed with all these medications, these very four types we're talking about, which is exactly what we don't want them on. The reason they're doped up with these medications is because they can get them out of the hospital sooner. Because sure, the patient's sleeping well now and the patient is responding to the medication, so let's go ahead and discharge them. No, 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 no. You have to be an advocate in the hospital, or you have to call your senior care advocate and say, I need you to come in. I need you to review these medications. I need to know they're not on any more medications than when they were admitted to the hospital. None of these beers medications. So the key message: you don't have to accept cognitive decline. It's not inevitable. You don't have to start putting your loved one on all these medications. You can keep them independent. It's just going to take you longer to get them either off these medications or figure out the behaviors, what's causing them. Trust me, you are going to have a clearer thinking, better balanced, and safer and independent living for your senior when you do this. And not only do we want this for our senior, don't we want this for ourselves? Do we want to end up on all these meds? No, of course not. So I encourage you to discuss with others in your support group or in our community support group, our network, what I should do. What tips do I have? Once I get them off these medications, and here's why they're on these medications, how do I solve these problems? How do I get them back to being independent again, better balanced, safer, and living their independent life? And if you have any questions, of course, let me know or reach out to the community. We're always here for you. Take care, and we'll talk soon. Bye-bye.